So in this video, we're going to talk about the difference between European biological medicine and functional medicine. Most practitioners, or even most people, have heard of the functional medicine. It's very popular now in the United States and Western countries, functional medicine. Um, but European biological medicine still is kind of not as well known. It's been practiced in Europe, and particularly Germany and Switzerland, for a very long time, over 100 years, but it's not really caught on in the United States as much. There are very few practitioners in the United States who are really utilizing European biological medicine and really um, using it to its greatest benefit to heal and reverse chronic conditions in patients. So in this video, we'll talk about the differences between these two really important concepts. So first off, they're both very useful. Functional medicine acts more like a green allopathic medicine, meaning it's really more concerned with symptom management. A lot of the lip service that functional medicine gives to treating root causes of disease is noble and admirable and a movement in the right direction. But my opinion, and from the opinion of many European biological medicine practitioners, it doesn't really address the underlying true root causes of disease. Functional medicine tends to focus on inflammation, which is important. Inflammation and lowering inflammation in the body is really key and really important step to helping patients. The problem is that inflammation isn't a root cause. It's a symptom of something deeper that's going on in the body. And from an European biological medicine perspective, we look at toxicity, unresolved chronic infections, and gut dysbiosis as the primary reasons and causes for inflammation to begin with. So once we start addressing the real root causes of toxicity, unresolved infections, gut dysbiosis, some other really important in the list that I have here on the right, you'll see that it's actually listed according to in terms of priority. So toxicity is a priority for European biological medicine, unresolved chronic infections, gut dysbiosis, autonomic system dysfunction, foci and disturbance fields, dental and systemic, diet and lifestyle, nutrition, allergies, energetic, geopathic disturbances, mental, emotional disturbances. So this is a kind of a general framework and a kind of general look at, in terms of bang for buck, in terms of if we were going to attack certain root causes, this is where we see the most movement with patients, especially with chronic disease. If we attack it from this point of view, if we address toxicity first and then work our way down. European biological medicine is really concerned with helping to restore self-regulation and self-management. And the way we do that, and true self-healing, is by removing root causes to self-healing and self-management. The idea is the body is naturally designed to self-heal. The body is naturally designed to self-regulate and self-manage. If it is not doing that and is a manifestation of chronic disease, is because there is some blockage to that. There's some blockage that's preventing the normal functioning of the body. And from this perspective, toxicity plays a huge role, if not the most primary role, in terms of dysregulating the entire body, the entire autonomic nervous system, the entire immune system, the entire detoxification system. So once we start addressing toxicity and removing toxicity, we notice a rebalancing that happens. And this is clinically what we see all the time, is patients start getting better and better once we start addressing toxicity. So toxicity is the number one cause, but there are other root causes that we just, as we mentioned, chronic infections becomes really important. And I'm going to be talking more and more about these on this channel, but I just wanted to give a bigger overview of these of how we think about root causes. From a functional medicine perspective, inflammation, diet, lifestyle, gut imbalances, hormone imbalances, chronic infections, all these are more almost symptom manifestation or surface level manifestations of a deeper dysfunction in the body that's not being addressed. So we can play kind of whack-a-mole with inflammation, with hormonal imbalances, with gut imbalances, but we're never really addressing the kind of primary root cause. And we see kind of a constant management of patients, constant management of symptoms when we look at it this more functional medicine perspective versus more this European biological medicine perspective. In terms of treatment toolbox, from a functional medicine perspective, diet plays a big role, and diet's very important. From a functional medicine perspective, it tends to be the primary goal, the primary treatment that is looked at. And diet can be really great as prescriptive prescriptive treatment for lowering inflammation, for treating a gut dysbiosis, it can be really, really powerful. It's a lot of times these prescriptive diets are difficult to handle for patients, and they're not actually very sustainable long term. We're still not addressing the root cause. If we give someone a low FODMAPs diet, are we really curing their dysbiosis? We're temporarily lowering the food that's feeding the dysbiosis, feeding the overgrowth, but we're not addressing the overgrowth, and the overgrowth is still there. When they stop the FODMAPs diet, they could even have a rebound, higher rebound. So we're not really addressing it holistically. We're not looking at the microbiome. We're not looking at toxicity within the gut itself. So prescriptive diets tend to be kind of the number one way to go. Pharmaceuticals, hormonal treatments, peptides, nutrients, herbs, fasting, oxidative therapies, detox modalities. These tend to be kind of the functional medicine toolbox, the functional medicine go-tos, and they are very powerful, and they can be very powerful at having patients respond and having symptoms respond. And I believe that they're very necessary and very powerful tools, but they're not really addressing, again, kind of at the root level of dysfunction in the body. From a European biological medicine perspective, we look at toxicity, we look at helping to address detox and drainage. We want to be helping support the body's natural elimination process. And through drainage, we deliver these remedies to patients. Patients take these remedies that are supporting the organs of detox, the main organs responsible for removing toxicity in the body anyways, metabolic waste process in the bodies anyways, the liver, the kidneys, lymphatic system, and the gut. These drainage remedies tend to be homeopathic in that there are low dose remedies of different herbs and minerals that not only provide the physical constituents necessary for the proper functioning of these organs, they're also energetic in that they're providing the informational and the blueprint information, the blueprints for the organ, how to function properly. So we're working on this really powerful double layer within the body, the energetic and physical, and we notice that they're so much more powerful than just giving something, for example, like glutathione, or giving something like chlorella, or something that's going to help to bind and pull and support detoxification in the body. It's not really addressing the body on this energetic way. We also utilize pleomorphic or isopathic remedies, really important immune modulation remedies that help to reverse pathogenicity within the gut and systemically within the body. We will also use oxidative therapies, organotherapies, nutrients, prescriptive diets tends to be important, but a little bit lower on the list in terms of priority. Herbs, fasting, energetic modalities are really important at supporting the body and helping to reestablish self-regulation, self-management from a European biological medicine perspective. When we talk about drainage, we talk about these remedies specific, again, to these organs of elimination. We have, so you can see here, the extracellular matrix, which is the matrix that surrounds all cells in the body. It's very important to understand this concept of the extracellular matrix because it is literally the water space, water compartment across the entire body that touches every cell, that the lymphatic system touches as well. That lymphatic system pulls toxicity and metabolic waste from extracellular matrix into systemic circulation by the blood to then get processed by the liver and the kidneys and be excreted out of the body as urine and stool, secondarily as sweat and as gas exchange via the lungs. So really important to understand this framework of how the body is naturally getting rid of toxins, naturally lowering toxicity, and how we need to support these organs on an organ level to get the best result and to get the best movement and regeneration and reversing of chronic disease within patients. And as a contrast to drainage, we have the concept of detoxification that most practitioners are really familiar with. This is really what you think of when you think of detox. You think of phase 1, phase 2, phase 3, transformation within the liver primarily, but it's happening across a multitude of cells in the body. And we get a phase 1, we get transformation into a little bit more reactive oxygen species. The toxins then get conjugated in phase 2. They get bound so that they become more safe for excretion as water-soluble components into the bile and to the liver. So these then get removed through the body, and how this is how the liver is functioning. So anything we can do nutrient-wise to support this metabolic cellular process with glutathione, with B vitamins, with magnesium, with minerals, with zinc, with phospholipids. There's a lot of ways and a lot of nutrients we can add in to target specific phase 1, phase 2, phase 3 pathways. But again, this is a targeted approach, more specific approach not really looking globally at the entire organ and organ network of detoxification in the body. Also critically important, necessary, but very, very different in terms of when we're thinking about drainage versus detox, and how clinically we're seeing better improvement with patients when we're using drainage remedies, because we can adjust dosages easily. The remedies are more gentle on the body, and this allows us to modulate it depending on severity of illness a lot easier than if we were going to just blast them with these nutrients, which we can do. I do with patients, but it is a time and a place for them. Whereas initially, we always go with drainage to help support the body in a really fundamental way. So if you're interested in learning more, I have a free masterclass for practitioners on European biological medicine, where I take a deeper dive, about 45 minutes, into the larger concepts of European biological medicine, where drainage plays a big role. And so you can learn about that. The link for that is my bio, and have that in the description below as well. And then I have an intro to drainage course specifically around drainage, to train practitioners what drainage is, how to utilize drainage, what the major companies are that you drainage companies that can be made available in the US, and they can be imported also from Europe, and where to get them, how to use them, how to dose them, what to expect when dosing with patients, different protocols depending on chronic conditions versus preventative versus more advanced conditions. So I go over all that. It's over a 7-hour course, and I try to really, really make it practical and useful, so that practitioners can start utilizing this with patients right away and seeing really fantastic, amazing results. So thank you for watching, and I will see you on the next video.